Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for joining us for this webinar to cover the latest public policy news in light of coronavirus or COVID-19. My name is Laura Barnett, and I'm on the marketing team at Axxess. Before we get started, I'd like to tell you a little bit about Axxess. We're a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Today, you'll hear from my friend and colleague, Deb Hoyt. Deb leads Axxess's public policy efforts and has a wealth of expertise across the healthcare continuum, having led the Connecticut Association for Healthcare at Home for the last 10 years before joining Axxess. Deb, I know you have a lot to share, so take it away.
Thank you, Laura, and hello, everybody. Thank you for taking the time to join us today to hear a little bit of an update on coronavirus, which is also known as COVID-19. We know you're all very busy handling this right now in your own agencies and in the field. What we're trying to do over the next half hour to 40 minutes is give you a synthesis of the information that has been really pouring out of the US government and nationwide on this situation so that you can handle it in the most effective way within your agency. So we'll start with a very brief definition. Most of us have been hearing about this. You're well informed about it. This is called the 2019-2020 coronavirus, but also known as COVID-19. We know it's a pandemic right now. It's a disease caused by the severe acute respiratory syndrome called coronavirus 2. So coronavirus is not new to us. It's actually part of 7 different viruses that we've become aware of in nationally and internationally. While some strains of this have been impacting animals, human beings have also been experiencing 2 different versions of coronavirus known as SARS and MERS over the past decade. So we've had experience with that. Public health officials have had experience with that, but the coronavirus COVID-19 is a unique version of this, and that's why they're calling it the novel coronavirus. We know it's a public health crisis right now of international proportion. It has a human, business, and financial component to it, along with community-based impact and personal responsibility. This is rolling out in the United States now. This webinar is being recorded on March 20th, and we know that many of the things that will be discussed in this webinar the numbers will be changing, the information will be changing, but the base of it are still very solid. Most importantly, what we want to do is make sure that everybody understands that this is for political, medical, and business leadership. It's an opportunity for us all to come together. We are in a very strong way at all levels of government and throughout the healthcare system, which is very encouraging. Private sector is stepping up as well through innovation and manufacturing. We're seeing unity throughout the community, personal responsibility to keep everybody safe and distanced from each other, to adopt the prevention model that is being used internationally. And it's a time for community-based action. So here's a brief timeline. We all know that this started back in December 2019. It was identified in Wuhan, China. Very quickly, if you fast forward 3 months to mid-March, March 11th, it was declared a pandemic by the World Health Organization. 2 days later, on March 13th, the World Health Organization declared Europe as the new epicenter of the epidemic. And on that same day, President Trump declared a national emergency here in the US, freeing up $50 billion to address the pandemic here in the United States. Very shortly that afternoon, President Trump also signed the 1135 waiver, which is providing regulatory flexibility for healthcare providers, including home health and hospice agencies. We'll talk a little bit more about that and the details. Within that past week, President Trump signed a second relief package, providing free testing, sick leave, telehealth, and other types of relief for physicians and hospitals so that they could ramp up quickly to be able to accept individuals who are showing signs and symptoms and those of who are actually ill and struggling with it within the hospital and inpatient setting. As of today, March 20th, and into next week, we're going to see several other healthcare measures come out in various packages. President Trump is scheduled to sign a third relief package today. I think it's in the Senate right now, and we think that there's going to be great bipartisan support to do this. This third measure is going to be addressing Americans and job loss, the financial and personal impact on them, as well as the personal and business impact on our smallest businesses in our communities. So we're hearing that individual checks are going to be issued to every American resident that is within a certain salary range, annual salary range. That's what Congress and the president would like to do to make sure that people who need to pay their bills on time and be able to continue and move along in terms of regular everyday life, if we can call it that, without defaulting on mortgages and other obligations. We want to make sure that the money is flowing to individuals. And the SBA, the Small Business Association, is also ramping up with making sure that small businesses are getting loans at this time of disruption and people are forced to close their businesses. So COVID-19, we're hearing it in the news. We're hearing all about what the various signs and symptoms are. The CDC, the Center for Disease Control here in the United States, has a very comprehensive website and issuing all kinds of information on a daily basis. Generally, they update their information at 4 p.m. every afternoon. We're seeing new things, new statistics coming out every day. But this graphic basically is confirming all of the things that we seem to be hearing and knowing in terms of what the signs and symptoms are. This is basically reported to be a mild to severe respiratory illness with some symptoms including a high spiking fever, a dry cough, and shortness of breath. So the challenge with this is that symptoms are appearing 2 to 14 days after exposure. People that have been traveling internationally oftentimes come back to the United States and say they feel fine, not exhibiting any type of fever, and then that's how it is. We're seeing it spread, between friends and families and within communities. So they're saying at this point, if you see signs and symptoms, please stay at home and monitor and call your local physician. Do not go to the emergency room. They're trying to keep emergency departments and other inpatient facilities just for those people that are most severely ill so they can treat them and keep the situation as isolated as possible. So we know this is a pandemic with worldwide impact. While this pandemic started in China, I wanted to show a distribution of it throughout other major countries. So we see that Italy, Iran, and South Korea, this is as of March 13th, this is just earlier this week, things have changed significantly. Italy, we're hearing, actually has more cases than China did, and China seems to be coming down the other side of the curve in terms of not having any new cases, which is a very positive sign. But there are probably about a dozen or so countries, including the United States, that are starting to quickly have this virus spread through their population. Right here, you can see that the United States is pictured there in a yellow on this graphic, probably at about 4 o'clock, the position of 4 o'clock. It's saying there were 1,016 cases. Well, as of today, there's over 10,000 cases, and that's just 5 days later. So we're seeing how quickly this spreads. But I think this graphic is a good illustration of the concentration and where it's moving from and to. This bar graph also shows the spread and how quickly it has spread to other countries. So very interesting. If you take a look at from the left side of this visual, the blue bars are representing China. Starting out in January of 2020, January 22nd, 2020 is the first bar graph there, shows the number of new cases per day, probably about 500 it started with. And then you can see how it ramps up in that nice bell curve shape and then spiking on February 13th. Then it starts to decline. And at the same time it's starting to decline, in late February, early March, it starts to increase. With the red bars being Europe, spreading quickly through Europe, the green bars being the Middle East, And then finally in the last phase, in the last half of March there, or actually the middle of March probably 12th through the 16th, it's showing the purple being North America and that being the United States, where it's rapidly spreading right now. So it's showing a decrease from China. Europe is still ramping up. So we know that this is not going to be a short-term situation. This will take probably 2 to 3 months to really run its course through each of these major geographic areas. Some of the things that we've been hearing about regarding the death rate by age group. People have been indicating that, this is something that is impacting our oldest citizens more severely. And we are seeing that individuals age 60 and up are the ones that are dying from this because generally they have underlying conditions or their health condition, some conditions they may have currently, adding this COVID-19 virus along with the respiratory situation is something that they just can't handle. It turns into pneumonia. It becomes severe in a way that their body can't fight it off. So we're seeing that the death rate in confirmed cases for 80-year-olds and older is almost 22%. It's interesting that we see that there are young people being impacted by this, and we need to be vigilant in terms of our younger population as well. They are not immune to this, and I think that a lot of the news reports that have been coming out have been talking about nursing home patients and other elderly, but we have to make sure that this is something that young people understand so that it's not moving through the population and spreading. Let's move back this way. So in terms of pre-existing conditions, yes, they have a major impact on an individual's ability to fight this off. So probably our 5 big categories here: cardiovascular disease, diabetes, COPD, chronic respiratory disease, hypertension, and cancer. If you have those types of conditions, fighting off this additional COVID-19 virus along with the respiratory stress is something that is more challenging for these individuals to fight off. Therefore, you see the death rates in the confirmed cases and all cases under these pre-existing condition categories so significant. So this is a slide of how COVID-19 cases are spreading through the United States. You can see there's various shading here. The darker shaded states are the states with the most concentration. We've been hearing from Governor Cuomo in New York. You can see that New York State is shaded with that darker rust color, along with Washington State and the state of California. This is a situation that's developing by the hour and by the day. So this is really a shot in time as of March 20th, just this morning before we recorded this webinar. So the states with the darker colors have the greater concentration of confirmed cases, but this map is going to look very different in a day or 2 days from now. Obviously, we know that individuals that are coming into the United States from other countries, like for instance, coming in from Asia, they're coming in through airports, or were coming in until obviously our airports now have been suspending and limiting people coming from other countries, but coming in through the West Coast, through California airports and Seattle, Washington airport, obviously coming in from Europe through New York City major airports and Newark, New Jersey. So that's why those concentrations seem to be higher than the central US. But things are changing rapidly. The count today, as of this morning at 11 a.m., were 14,439 confirmed cases here in the United States. That number is going to be increasing by several thousand, probably per day. So this number is changing. Just wanted to give you a snapshot in time. 152 people were confirmed dead in the United States from this virus. So this is a very serious situation. The position we're taking in terms of attacking this virus and the spread is through prevention. We've heard about social distancing, and really it's all about the numbers. We can see by this graphic, it's a really good, clear graphic, that one person infects 2.5 people within 5 days, which means that in 30 days you have 406 people infected. But if we can follow the distancing required by our government, we're looking at 50% less exposure, or even 75% less exposure. So if we can keep people through social distancing from infecting each other, we can really get a handle on this. Testing is another way to make sure that we can reduce the incidence of exposure and keep people so that they're not spreading it to their friends, loved ones, and other people within the community. So testing lagged a little bit in the United States until the number of actual tests were available. They were released earlier this week. I know the president and Congress were very aggressive with trying to get these tests out to individuals. Then they had to make sure that there were labs available to process these. Originally, we were hearing that there was a 4-day turnaround in tests. Right now, we're hearing that it's a day or less, and maybe some of these within hours. So we're moving in the right direction. Obviously, we can see on this chart, starting in January, there was very little testing available, and the blue codes, the blue bars, were CDC labs, and those were the ones that were originally testing. Now we've moved on to local state health departments and other labs like Quest Laboratory and some of the other laboratories that normally process blood work for individuals have been opened up to be able to process this testing. So that's been something very positive, and we're increasing those numbers of tests and availability very quickly. One of the things you've probably been hearing about in terms of prevention and testing is the philosophy about flattening the curve. So this goes back to us making sure that we get a hold of this, we follow prevention guidelines and testing so that we can make sure that our healthcare system capacity is not overwhelmed. We know that there's going to be probably hundreds of thousands of individuals in the United States that are going to be contracting this virus. You know, we've heard estimates up to 25% of the population will have this within a month or 6 weeks. We're still not sure, but we know that with prevention, we can flatten this curve, meaning that the red bell curve that you see there on the left side, that's saying without intervention, we're going to see a huge spike in cases, and it's going to surpass our healthcare system capacity, meaning that people flooding the emergency departments are just not going to be able to get the care they need. We don't have the number of respirators that people that are seriously infected are going to need to be able to recover. And I think that our best way to address this as a nation and a world has been to look at intervention with hand washing and social distancing to, while we have the same number of people potentially infected over maybe a longer period of time, the severity of the cases and the number of cases in a shorter period of time have been reduced so that our healthcare system can handle this. This is something that all of you are seeing right now if you're in the healthcare field. We know that our emergency rooms can't handle it. There are hospitals that are restricting all types of voluntary surgery so that they can use the med-surg units to house these individuals. I heard yesterday on the news that there's a San Francisco hospital that is 100% full with just COVID-19 cases. Every single individual in that hospital is on a respirator. So this is something that's ramping up extremely seriously. We're hearing President Trump, the administration, and CDC and health leaders doing televised public press conferences every day on this. They're taking this extremely serious. There's a COVID-19 task force with many of the national healthcare leaders supporting this, this fight against this disease. They're calling it the invisible enemy. Dr. Anthony Fauci, he's the director of the National Institute of Allergy and Infectious Disease at the White House. He has been part of these briefings, and I think his quote says it all. How we respond to this challenge right now will determine what the ultimate endpoint will be. And we certainly know that. I think we were a little behind the curve a few weeks ago, but I think we're jumping on this very quickly, and I think we are able to flatten this curve. So our national health policy focus has been around prevention. I know that President Trump was on the phone in a conference call with all of the state governors yesterday or the day before. State governors and state health departments really are the ones that have the jurisdiction for the local implementation and are the ones that are mandating preventative measures that are coming out of the federal government. So we're hearing state governors on your local televisions and in your local area, along with your mayors, sending you emails, sending you updates in terms of what you need to be doing within your local community. Obviously, they've been promoting and requiring the hand washing and personal hygiene, social distancing. We're seeing that local schools have been closed this week, along with next week and potentially the next 2 or 3 weeks. Universities around the country have all been closed. Many of them actually will be closed now for the rest of the semester. So we know that students are, struggling with trying to figure out how they're going to finish their coursework for the rest of the semester and even graduate. This is disrupting, obviously, every aspect of our lives. Public places of gatherings, such as bars and restaurants, retail establishments, many of them are ordered to be closed. I know in my state, they've been ordered to be closed for 2 full weeks, and then they'll be taking a look after those 2 weeks, whether they need to close them for up to 3 months. We know that people need to be getting food. They're going to grocery stores. Grocery stores are open. There's food delivery. Restaurants are actually allowing people to come order online or order by phone and then do takeout. So we have to keep, people fed. We have to keep our day-to-day lives moving. But, if we can all hunker down and make sure that we can maintain the social distancing, it's really going to flatten that curve. Restricting visitation to all nursing homes except for medical personnel. Hospice now has been allowed to go in there to take care of people at end of life. Many businesses are adapting to the virtual or work from home model to support social distancing. I think that it's been working quite well for some. There's other industries that just don't have an option to work from home, and many people have been laid off from work, or they're going to be filing for unemployment. This is going to put a huge pressure, obviously, on our financial system and on our government to try to keep things moving financially. We know that this has impacted the stock market, along with all kinds of other financial indicators here. But we hope to get through this quickly. The government wants to support U.S. residents through these checks and keeping people so that they can keep their homes. We don't want to have foreclosures. We want to get through this as a country together. We're hearing all about limiting all non-essential air travel. There's other restrictions about closing the borders from the United States and Canada, making sure that people are not coming in from other countries. Their enhanced screening, the TSA is doing what it can at various checkpoints. This is critical right now to make sure that we keep our borders closed for this purpose. There's other cancellations in terms of large group meetings, over 10 people. We know that right here in the healthcare field, most of our National Association conferences have been canceled and moved to virtual online meetings. Other people are taking online courses, and I'm trying to do whatever we can to order things that we need within our home for our families in an online way too as well. So I think the most important thing right now is probably keeping people calm and compliant. And it's really challenging in a 24/7 world news situation. I know that people turn on their TVs and they're incessantly watching this. And I think that panic is something that really can destroy a nation very quickly if people get overwhelmed with this. And we are seeing that. And people need support, and people need to have an outlet for good information. So I just have a couple of websites up here that are trustworthy. I've been checking them out multiple times a day, and I know that many people around the world are. So the World Health Organization, WHO, along with in the United States, the Center for Disease Control and Prevention, the CDC, have good information. Johns Hopkins University has a real-time tracker on their website. If you'd like to go there to see the minute by minute for every country in the United States as well. I hear, though, that some of these trackers are actually being hacked. So you have to be careful on what you're clicking on. Just make sure you're going to reliable information. There's information from the CDC on travel advisories, on symptoms, prevention and treatment, what you should do if you feel if you're experiencing symptoms. And please go to these reliable and direct sources. Don't click on links or emails in terms of things that might be coming through. We are seeing more and more individuals taking advantage of people nationwide by hacking and trying to get you to click on links that you might think would be good information. The home health and hospice industry has been very aggressive in making sure that it's dealing directly with Congress and the White House on making sure that we get the relief that we need, that we get the flexibility in terms of treating and caring for Medicare and Medicaid patients. And they also have information on their website. So NAC, NHPCO, the Partnership for Quality Home Health Care, which is our Medicare partnership, along with Axxess. Axxess has a full coronavirus resource center online with all kinds of reliable links and information for you too. So please make sure you're going to reliable information. So this is a time for leadership. We know that more than anything. We know this is a public health crisis that will last for up to 6 months or more, and it has wide-ranging implications on our lives. We need to make sure that we have strong leadership in place. We know that the healthcare system is the leading front line for this, and this is going to be very stressful for our sector and all the people that work in it. These are all champions, and we need to make sure that we support them. The international leadership community has been working collaboratively around the clock, and the best thing is we're learning from each other. We're learning from the China experience. We're learning from what's happening in Italy. And there's medical evidence and data now that we can share and learn from to make sure that our United States experience is as minimal as possible, although we know that it's here and it's going to be quite disruptive for a while. So we want to make sure that we follow our preventative measures so that we can get through this as a community. We know that the healthcare system will become overwhelmed by people who are ill, and those that are not complying with social distancing and hand washing measures are really going to threaten the rest of us. So we really have to make sure that we continue to push this. One of the larger challenges that we're hearing day by day is that medical supplies, including personal protective equipment, it's the acronym is PPE. A lot of people are just using the acronym PPE. So we're talking about masks, gloves, gowns, other types of protective equipment. They're in short supply, and hospitals and health systems and home health care agencies are going to have to figure out how they're going to prioritize the use of these for the most critical patients. We're even hearing that hospitals are washing and reusing or sterilizing one-time use PPE items. So this is where we're going in terms of making sure that we have enough available. I did hear an announcement from President Trump saying that he is asking industries that may not be normally manufacturing this type of equipment to adjust their manufacturing to see if they can produce this. You know, we're even seeing that construction masks are now going to be used by the medical community, those paper construction masks. So we need to improvise as much as we can. So we know that President Trump and the Congress has been rolling out all types of relief and packages, flexing and being a little bit more accommodating to our medical providers and our industry to make sure that we're able to adjust and care for people that have this. So President Trump proclaimed the COVID-19 national emergency, making the $50 billion available to states. That was huge. He also suspended entry into the United States. We wanted to keep the virus from coming into our country by people coming off of airplanes and cruise ships and other ways. He signed the COVID-19 emergency declaration this week, which was the 1135 waiver. This was really helpful for medical providers. It allows out-of-state providers to be able to work across borders. So for instance, if you're a nurse or a physician that is licensed in one state, but a neighboring state needs additional medical services and needs more workforce, it relaxes the licensure so that you can work across state lines. It also eases the timeframes related to OASIS transmission for home health agencies. We have some questions in regarding what that easement means in terms of timeframes. We're hearing that it's the full extent of this emergency. So if this goes on for several months, that's what we're hearing in terms of OASIS transmission timeframe. So we'll get more clarity on that. Just this week, earlier this week, we heard that 1.9 million COVID-19 test kits have become available, and there's 2,000 laboratories nationwide that are able to do that. Many more test kits have become available, I think, just this past week. We heard that 400,000 test kits were put out by Roche Labs and are going to be able to be processed by them as well. So we're hearing every day that the public sector and the private sector are working together to make sure that we can get ahead of this. One other thing that's been of concern is that hand sanitizer has been unavailable to people, and the FDA granted some temporary approval to pharmacists to actually make compound certain alcohol-based hand sanitizers to address the shortage and get that to hospitals and other types of medical facilities. So in terms of some additional leadership that we've seen in terms of President Trump signing relief packages, the most recent one, the second one that came out just 2 days ago, paves the way for free coronavirus testing, also allows for paid leave for some employees of smaller companies, and that's very helpful for those businesses that must close or have been mandated to close. There's been an increase in support for the SNAP program, food security programs, and Medicaid beneficiaries. We're also hearing that schools oftentimes who feed most of their students, particularly elementary school students, they might just be receiving their breakfast, lunch, and dinner at school when they're at school, but if the school's closed, they have no other source for nutrition. So we're hearing that schools are actually packaging meals for students and allowing parents to come drive through and pick those up in the parking lot of the schools. So we're coming together to make sure that people are fed, people have cash on hand available to get through for the next couple of weeks. So we're hearing that these cash payment checks, which should be approved today, we've been hearing various amounts, but we're hearing that it's a check of $1,200 per individual, $2,400 for a couple, and $500 per child if you were under a certain annual income range. So I think that people under the $75,000 a year range will be getting something in that ballpark. This can change based upon what comes out today. We're hearing that if you make over $100,000 a year, you will not be eligible for any of this funding. So things are evolving, but this is what we're hearing as of today. We're also hearing that the next wave of relief will be President Trump invoking the Defense Production Act. This is something that basically goes back to the 1950s when we were at wartime or we needed additional supplies here in the United States. And basically it helps to address the shortages that we're seeing in medical supplies, and it's going to allow other manufacturers to produce this personal protective equipment, the PPE, that's needed by clinicians and all of our hospitals and inpatient centers at this time. Some of the specific relief that's come to home health and hospice providers through this 1135 waiver has been very helpful in terms of relaxing certain rules and conditions of participations, the COPs for home health, hospice, and other healthcare providers. So as of retroactively to March 1st and extending through this declared emergency period, there's going to be all kinds of relief in terms of non-emergency survey inspections for home health. We're not going to have to worry about our state surveyors coming in during this period of time. It's also allowed the expanded use of telemedicine. Initially, this expanded use is for physicians and hospitals. We're working very hard to make sure, and I know that our national associations have been advocating so that home health can use telehealth, whether you're using it on your cell phone, your laptop, your iPad, or some secure device, so that you don't have to go in to homes where people potentially do have the virus, or you don't want to expose them to the virus, and be a little bit more efficient regarding check-ins with our home health clients, and also being able to bill Medicare for this. So these are coming soon. The CMS administrator, Seema Verma, is basically making announcements daily. This is where we believe it's heading in terms of home-based telehealth under the Medicare beneficiary rules. In terms of some of the blanket waivers, we are seeing that it provides some relief to home health agencies on the timeframes related to OASIS transmission. said that that's probably for the full amount of time. We'll get some more clarity on that. It also is allowing our MACs, our Medicare administrative contractors, to extend the auto cancellation date of our RAPs, the request for anticipated payments during this emergency. We know that we're also going through PDGM implementation right now and ramp up on that. And we're thinking that there might be some challenges around complying with some of that. So our national associations are inquiring as to, whether some of the restrictions that we might be going through just because we can't get in to see patients, in terms of LUPAs and other things related to that, we are actively trying to make sure that we get clarity around that for you as well. And we talked about out-of-state providers being licensed in a certain state, being able to provide services across lines, and that applies both to Medicare and Medicaid. Some of the other regulations that are being eased are really around provider enrollment, and this basically pertains to Part B suppliers, physicians and non-physicians who can enroll temporarily and be able to bill Medicare for basic services. There's also relaxation regarding criminal background checks, application fees, revalidations, and new applications. One of the good things that was able to be passed about a week ago was hospice workers were officially allowed and permitted to be able to go into nursing homes so that they could care for patients at the end of life. Additionally, initially there was some restrictions around who could go into nursing homes. Obviously, we're seeing nursing home patients needing care at the end of life, and for hospice to be able to go in there and continue their care is important. On the Medicaid side, there was an announcement yesterday that federal Medicaid matching funds to states will increase across the board by 6.2%. That will help states. I'm not sure if individual provider sectors will receive any increase in Medicaid reimbursement. We'll push certainly for that, but I'm not sure if that will be happening soon. That's something that's desperately needed. We know that. We talked about out-of-state providers permitted to render services. Yes, that's under Medicaid as well. And temporary suspension regarding enrollment and revalidation. And there's some other pre-authorization requirements and pre-admission screenings that these are all under Medicaid. So this is really helping in terms of making sure that healthcare workers are doing what they can do to care for patients. Some of the very encouraging things we're also seeing, obviously, we talked about government and business leaders partnering and really letting the private sector step in to help us as a nation and help the government achieve through innovation some very good things. So we're seeing that, for instance, Google and Quest, they're partnering with the US government to get a screening website up to date. So Google will actually have a COVID-19 screening website that people can go in and use potentially to assess their symptoms, and maybe it would be something that they can contact their doctor directly with. Quest has stepped up with 2,000 test sites across the country to be able to process the COVID-19 test. We're seeing the test evolve from a more time-consuming test to a swab test that hopefully is less than a day or several hours to be able to come back, so people will have results more quickly. So having the brightest minds in the private sector come forward at this time is really important. Even before the 2-week mandated closure of some stores and restaurants and non-essential businesses, we had in places like Apple voluntarily closing their stores to ensure the social distancing across the world actually was taking place, and I think that type of leadership is very important at this time. Some of our large retailers like Target and Walmart are offering their parking lots so that there could be drive-through screening. So we're seeing kind of temporary hospital tents set up there, and individuals are being able to be screened in large community-based parking lots, especially for those individuals in rural areas that don't have hospitals and other types of medical facilities as close by as some of the people in more urban or suburban areas. this is very important to them. We're also seeing that we're going to be needing additional beds and housing as hospitals and the health system become maxed out in terms of capacity. And with universities closed now for the next several months through the end of the semester, we're seeing different universities step up and say that we have dorm rooms that we're going to clean and make sure that they're available so that hospitals and healthcare workers that need extra beds can come in and use our facilities as well. Same thing with some of the hotel chains. They're stepping up, making sure that if they have extra capacity or they have facilities that can be used for that same reason, it's something that is available to us as well. We are going to see a large national spike here in the United States. Despite the social distancing and the hand washing, we know that this is on its way and we have to be prepared for it. And lastly, I think in this time, people need reassurance and they need hope at this time. So I think that this is something where, our religious institutions, while maybe they're closed on Sundays for worship, and we can't gather together as a greater community publicly, there's online worship and there's online services, there's meditations, there's online yoga and other types of ways that we can get together and share experiences and share basically the challenges that we're going through individually and collectively, and kind of keep our spirits up and keep up hope at this point. I think that's an important thing for our nation. So the message is, and we're hearing it everywhere, is that we're all in this together. I saw this quote actually on social media yesterday, and I thought that it was very interesting. It was from Alexandra College. It says, "Do not change your behavior to avoid being infected. Assume you are infected and change your behavior to avoid transmitting." And it really turns this around from the I, all about you, to the we. It's really a collective situation we have here. And I think that we are all able to do this together. And Margaret Mead said it best many years ago: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." And I think our healthcare community has stepped up tremendously. Our political leaders have as well. And we're hearing that for the first time, we're seeing Republicans and Democrats come together to quickly pass these relief bills in Congress, and the president is signing them as quickly as possible. So the universe has brought us all together at this time to work together, and it's very encouraging to see it all come together at this time. So as a healthcare community, thank you for all you do. This is very important right now, and we're all stepping up, and we appreciate your time. Laura, do you have any closing comments for us?
I do briefly. Thank you, Deb, so much for the insight and the facts, but also approaching this as a person and understanding that we are all in this together and providing resources for us, not just from a physical health perspective, but from a mental health perspective as well. We know how crucial that is in this time. So we greatly appreciate your time. We greatly appreciate the audience's time. We know that you have a business to run and you have problems to solve. And this is an additional challenge that you are facing at this time. So we are delighted that you have chosen to trust us to provide you this information. We appreciate your time and your attention as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Have a great day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.